Hey, this is Brandon Steele. Welcome to the Mainsail Financial Group Podcast series, where we host industry experts and local professionals just to really help share some areas, some guidance into the topics that we don't really get a focus on day to day. And today we want to thank Chris Wolpert for joining us. Chris is actually located down in Tacoma. He helps a lot of companies with their benefits packages. His goal, as far as I understand it, is to basically set out to help eliminate employees out-of-pocket healthcare costs, but also share where to get the highest quality healthcare along the way. So I'm excited to hear about how he plans to do that. Definitely big goals. Excited to break it apart. He helps companies, evaluate their benefits plans so that their employees feel empowered and confident. And is also Amazon best-selling author. Frequently asked to speak at events. So we're super excited to have him. Plus, he's a fellow Coug alum. So go Cougs, and definitely excited to pick your brain here a little bit today.
Awesome. Well, yeah, I'm excited definitely to share with your audience what we do. And as you mentioned, how can you go without saying go Cougs?
That's right. Yeah, I think we have really good timing to have you on too, because I know, for a lot of folks, open enrollment is right around the corner. So whether employee or employer, like this is on everybody's minds right now. So definitely excited to talk about how we can kind of take advantage of the group benefits and get in a better spot here.
Yeah, absolutely. Well, let's dig in.
Yeah, and maybe let's start with this claim of yours, which I love, which is basically to eliminate employees out-of-pocket healthcare costs and increase the quality they're getting. So it's an awesome goal. It's a lofty goal. I love it. So can you just talk a little bit more about what that means to you and, how you're kind of helping people get there?
Yeah, absolutely. Well, first and foremost, what I noticed several years ago as I really kind of started to focus more so on the group health insurance and group benefit space and those types of things was that a lot of times what ended up happening was somebody that's a consultant or a broker or advisor, such as myself, would get into a room with leadership, ownership, the finance department, the HR team. And basically it was a small group of people who were making the decisions that were going to affect all of the employees and their families across, all the companies that we were working with. And it was that way at every organization, whether they were a prospect or a client or whatever the case is. And so inherently, I think that's a problem because what ends up happening is your average employee or your employee that's not part of the finance or the HR team or one of the owners or principals, we're really just kind of left out in the cold, confused. And then the problem would become is every year it seemed like those costs would go up. And what ended up happening is a lot of times that group of people that we just talked about, that cabal, would be making these decisions, but they'd end up cost shifting. And they do it in a number of different ways. But what ended up happening was deductibles would rise, out-of-pocket expenses would rise, and yet the employee's premium share would rise as well. And now at this point, you're hard pressed to find any organization that doesn't have the employees contributing something towards their own, towards those employees' health insurance or those employees' health insurance premiums. And it's extremely rare. I mean, it's a black swan event when you find a group that's actually contributing anything towards the spouses or dependents anymore. That just seems like that just doesn't happen any longer. So my point is that the employees have really just kind of had backed away from this decision completely over time, weren't involved in it, weren't necessarily invested in it. And every year it was bad news, right? And so what we wanted to do was kind of flip everything on its head, which led to that value proposition, where our mission, the center of the bullseye for us is to eliminate employees' out-of-pocket expenses while simultaneously guiding them to the highest quality healthcare. And so there's a number of different ways that we can go about doing that. It is kind of a broad thing. It is a broad statement. It's meant to kind of capture somebody's imagination and also to get their attention so that to see if they want to continue that conversation. There's plenty of folks that even on the HR and the finance side that have just been conditioned to believe that there's nothing they can do to control this second or third highest line item on their P&L. And yet they don't understand that they can actually do that. So sometimes, it's just as simple as trying to find those people that are just fed up and that want to make a change and that are really willing to put in the time to understand how to do it and then to actually do that. Because like with any change, there's going to be employee noise. And again, those employees have been conditioned to think that there's nothing they can do to control their healthcare costs either, that they just simply have to get this card in their pocket. And that's the way they access this fragmented, opaque, confusing, and many times expensive healthcare system. So that's kind of where we were starting with. And so again, like I say, to eliminate employees out of pocket expenses while guiding them to highest quality healthcare, it could mean simply getting them their brand or their specialty medications at a lower cost or at no copay. It could mean getting them in to see a primary care physician with no copay, or a specialist, or to have an image or a scan or a diagnostic or what have you. The thing is because the healthcare system is so confusing and opaque and all this, that when we focus on quality first, there's an inverse relationship between cost and quality. And what tends to happen, and it's this way in other markets too, but certainly in Western Washington, which I imagine is where most of your listeners are coming from, it's that way, in that the highest quality providers tend to bill at the lowest reimbursement rate versus the low quality providers that bill at the highest reimbursement rate. And there's a number of reasons behind why that is factually true, why that is the way it is. But the point is that there's a number of different angles that we can attack that cost and quality from in order to ensure that people are getting the highest quality coverage, the care, the right care at the right place at the right price. Ultimately, that's what the byproduct is there when we put quality first and begin from that standpoint.
Sure. Okay. And from what I understand, I think a lot of that is done through the actual plans themselves, right? The group plans that are being offered. And I think, so you wrote the book, Next Generation Healthcare, which I think talks a lot to that, right? Like what you can do and how you can design a plan to handle that. So that's a perfect segue. If you can maybe share a little bit, like what, how that works internally and how that translates to that lower cost.
Yeah, absolutely. Well, the first thing you need to do, and I kind of alluded to this when I talked about, again, focusing on quality, but it's you really need to begin to wrap your head around, and I don't care what size group you are, I don't care what kind of funding arrangement you have, there are ways that you can get access to the claims data that specifically is taking place within your group, and you can then leverage that data to build a plan or create a plan that has those incentives in its architecture, in its design. So again, I'll just take it from the most obvious end of the spectrum, where a large self-funded group, or even a smaller self-funded group, but a group that is doing some form of self-funding, is going to have direct access to their claims data through their TPA and through their stop-loss carrier. So they're going to be able to see where the claims are taking place. If you've got high musculoskeletal, if you've got a lot of people that have maintenance kind of conditions such as diabetes or heart disease, right? You're going to be able to, when you have the ability to pinpoint the claims that are taking place, that's where you can really begin to introduce strategies and solutions that are going to attack that cost problem head on by driving quality up. And so what I mean by that essentially is, what you can do is, if you've got a small, because typically this is how it shakes out, you've got about 5 to 10% of your population of employees. Again, I don't care what funding, I don't care how big you are or how small you are or whatever, 5 to 10% of your group is spending 80% of the total claims volume that's taking place within that group. So a disproportionate amount of people at your company are spending an exorbitant amount of the claims. And so if we can just simply focus in the beginning, if we can just simply focus on strategies and solutions to help combat that cost, that segment of your cost, by providing higher quality providers, facilities, by getting your prescription drugs to you. And so, one of the common things that we see a lot of times, Brandon, is that a lot of times we have people that are skipping care these days, and they're doing it because they're afraid of the financial consequences. So they're not going in for those routine checkups as they should be. They're not following through on doctor's orders. They're pill splitting, meaning that rather than taking the full dosage over a 30-day period, they're splitting those pills in half, and then so they're taking half the dosage but spreading it out over 60 days because they're afraid of the cost. So if we can begin to have an effect on that small amount of people that have a disproportionate amount of the claim spend, that's where we can begin to drive quality up, and we can bring down costs for those individuals that are experiencing the most amount of healthcare service needs, but also for everybody else, because a rising tide lifts all boats. And so if the company as a whole is spending less on healthcare, then ultimately they're not going to have to do that cost shifting game of what do you call it? I don't know. But they're not going to have to continue to do that every open enrollment, right? So that's kind of one area that we begin. But then as we start to focus on delivering higher quality care.
Can I pause you real quick just before you?
Yeah, go ahead. I'm sorry.
Okay. So just to make sure I understand it right, you mentioned the 5% basically, is where 80% of that cost comes from. And so basically, I think what you're saying is that for that 5%, it's making sure you have preventative things in place, making sure that, that you're finding the best drug coverage, whatever it may be, just to reduce those costs or minimize future costs by getting ahead of things. Is that fair to say?
Yes. And part of it comes down to, in that example I was sharing, that, a self-funded group, you have much more control over kind of the internal workings of your plan, right? So you can pull a lot more levers and push a lot more buttons than, say, a fully insured group can, in order to keep those costs down or to introduce solution providers that are going to allow us to do that. So that is a key component of it. Now, if you are fully insured, there still are things that you can do. There are bolt-on non-insurance solutions that we use on a regular basis in order to begin to move people in that behavior pattern, because you're really never going to convince people to be healthier. You're not going to persuade them to do that, but you can provide the incentives. You can make it easier for them to make those kinds of decisions, where now they're seeking out higher quality care, they're seeking out higher quality doctors, et cetera. But they finally, for the first time, perhaps, have the transparency because of having this peek into the data. That's what really is the baseline that allows them to begin to start to move that direction. So hopefully that kind of ties a bow around that first point.
Yeah, I think so. Sorry to interrupt. I just wanted to make sure I understood that properly.
Yeah.
So thanks for elaborating a little bit more. Yeah, and then so I think you were going to part 2 of that is the quality, right? So sorry to interrupt, but feel free to pick up there.
Yeah. And so when we're designing a plan that has quality first, one of the things that we like to do, because, it's a little bit different than just simply having a big wide open network. And that's another thing that I think that employees in particular, but also HR teams are conditioned to ask about is, well, how big is the network and how many hospitals and how many doctors and all this? And my point to them is, look, it doesn't matter. It doesn't matter how big the network it is. You could have the hugest network ever. The problem is good doctors as well as bad doctors are going to be included in that network. And so a lot of times when you're looking at those like provider directories to make sure somebody's in network, because typically that's what happens, right? If you're somebody who doesn't use a lot of healthcare, you're going to go into your HR department and say, hey, I've got, potentially have this condition. I've had this diagnosis. This guy's recommending I go in for a surgery. I'm not sure what to do, this or that. And the answer is, well, let's pull up the network directory and let's see who's in network. And the problem is that you pull up that directory, you start to look for doctors in the area. Typically, you're going to look for a doctor whose name you can pronounce, or who's, you might recognize where their office is at, type of thing. But really, you're not looking at any kind of quality behind, hey, does this doctor have open malpractice suits? Do they have any, what's their readmission rate? What's their reinfection rate? How many mortalities have they had if they're a surgeon in the last 12 or 18 or 24 months or what have you? So what we can do when we're constructing a plan is we've got the ability to look at CMS data, a number of other different databases, 17 to 24 different databases, using AI technology, using clinical specialists, meaning we're using nurses and doctors to vet out all of the doctors that are within the network. And then when somebody engages with that part of our team, then they can get their care at no out of pocket, at no deductible, no copay, no co-insurance, whatever, if they go with the care path that's outlined by our team. Great. If they don't, if they're one of these stubborn people that just says, you know what, I love my big wide open network, I just want to find somebody whose name I can pronounce and that I know where his office is or her office is or whatever, that's what I want to do. Okay, great. You can do that. But just know you're going to engage with the plan the same way that you are today, meaning you're going to have to meet your deductible. You may have to pay a copay. You may have co-insurance until you hit your out-of-pocket maximum, but literally nothing else is going to be different for you, right? You can continue to do that same thing. And so when we design a plan that way, when we design a plan that incentivizes people, doesn't mandate that their behavior changes, but it incentivizes people to seek out those higher quality options, and ultimately they get rewarded for it. We know that obviously that's the best outcome for them because we know that they're going to a higher quality provider, where we can ensure that the outcome from a clinical standpoint is going to be favorable. We also are eliminating their out of pocket. So we're removing that barrier that's kept them from going in or kept them from moving forward with this procedure or what have you. And then the employer, ultimately who's paying the bill, whether you're fully insured, if you're large or small, self-funded, whatever, again, it doesn't matter. Ultimately, the employer is the one that's footing the bill in many of our cases, unless you're on an individual plan, but even still. And so they win as well, because ultimately they're not paying as much in claims. They're not having as high a volume in the claims, which ultimately is what is pushing those prices up year after year after year. And so ultimately they're a winner as well. Really, the only people who lose in this are those low quality, opaque, non-transparent providers who don't necessarily specialize, right? The ones that kind of do a little bit of everything rather than just do one specific thing and do that one specific thing really, really, really well.
Okay.
So
and you're not necessarily suggesting like shrinking the network. You're just suggesting
Nope.
that you guys have a service to help find the right people within that network that can reduce your costs and therefore employer costs and quality and all that comes along with it.
Yep. That's
Okay.
exactly right. That's exactly right. Yep.
So how does that work in like areas a little further out, right? So I imagine the cities like Bellevue, Seattle, probably no problem. Tacoma, no problem. As people maybe are a little further out, are you finding that they do have to travel to find those type of providers, or are there still people out, across the state basically for that, or country for you?
Yeah, they're yes, exactly. They are. They're really everywhere, and that was kind of something that comes up a lot. I mean, we've got a few companies that are out in like Grace Harbor, Aberdeen, Hoquiam, that area, and that's always kind of their big concern is like, well, yeah, this sounds great if I'm in Olympia or Tacoma or Seattle or something, but does this really work out here? And it does. And we found that even some of these places that are more rural, right, it tends to work even better a lot of times, because part of when we're structuring a plan this way, one of the benefits is also to the provider. And so this may only, be something that really a very small portion of your audience cares about, but it's worth mentioning, is that a lot of times what we can do is, because we have separate reimbursement arrangements from these more traditional networks, even these rural providers, we can pay them faster. And what I mean by that is that typically even a small provider's office is spending 40 cents trying to chase $1 from insurance companies. So when we put in one of these bespoke custom plans, for example, we're also going to the providers in that immediate area and those immediate zip codes around that employer or where their employees are, and saying, hey, here's what we're going to do. Here's how our plans work. And if you are one of these high quality providers that we've vetted out, then we're going to pay you directly and we're going to pay you faster. So typically, rather than having them spend 90 to 180 days or more just simply trying to get that process going and getting paid, we can get them paid in typically a 30 to 45 to maybe 60 day on the high end period. So we're getting them paid quicker and they're spending less to chase after that dollar. So the employers, or excuse me, the provider community, those high quality providers, at least anyways, tend to benefit from these types of plans, and the ways that we design plans as well too. And so, yeah, it works just as well in Hoquiam as it does in Seattle.
Sure. Yeah, that's good. It's I'm glad I was on the right track for that question. Sounds like you get that a lot. So
Yeah.
you mentioned so obviously we're trying to save employees, but we're also saving employer costs as well. And so I'm curious, this is kind of a two-part question. So I'll start with part one. For these plans that you've implemented this way, right? Have you noticed that that employer's 401k plan gets better participation or anything along those lines because now there are more money in the employees' pockets to save for their future and, not spend where they don't need to, kind of thing?
Yes. Well, and here's the other thing is I'm sure you know this, Brandon, but the number one reason that people take hardship withdrawals from their 401ks is because of unexpected or incurred medical expenses. So that is the top reason why people are pulling money out of their 401ks. It's also the number one reason that people are going bankrupt in this country right now, which seems crazy because there's no other line of insurance coverage that you're afraid that you're going to go bankrupt if you actually use it, right? Your home burns down, your homeowners is in place, you get in an accident in your car, your auto insurance is going to, repair it or replace it or whatever. But it's not that way with health insurance. So yes, so we see less in terms of 401k hardship withdrawals, which is obviously important in people building and creating wealth. But we also tend to find that now people have more financial stability. So if they are one of these people who typically does incur a lot of claims, they're going to the doctor quite a bit, they may have to meet, $5,000 to $10,000 of deductibles and out-of-pocket expenses every year, and they've just kind of accepted that. Well, if one of their employers was to go with one of our options, then suddenly that employee, it's like getting a $5,000 to $10,000 raise. I mean, can you imagine that? Of course, that's going to have a downstream effect on those employers. The other thing it's done, and you didn't ask about this, but I'm going to just throw this in there.
Sure.
The other thing that it's done too is when employers right now are really trying to do whatever they can to attract and retain employees, as the Great Resignation is upon us. And one of the other things that we're noticing as well too, and the way I like to frame this with employers is I tell them, hey, look, why don't you do this? Why don't you just A/B test this? Next time you've got a job, opening, or when you're trying to get a position filled, put out there what you're doing in terms of benefits. So, put the job description, the job duties, the pay scale, medical, dental, vision, 401k, and then also put, do the B test of that is put out there the fact that you've got a zero deductible or a free healthcare option or free, that type of thing. And what we find is that they have 3 to 4 times more callbacks for that ad that mentions the free healthcare, the zero deductible plan, what have you, because now you as an employer are differentiating yourself from the rest of the market that's trying to hire people, as well as you're providing a very inexpensive, and in many cases, actually, again, we can produce savings in that first year. You're giving an enhancement to your existing plan that rewards your employees for their loyalty and for them to stick around. And so, any of those types of things is always going to help contribute to improving the plan performance of the 401k and the participation of it and those types of things as well. So.
Yeah, that's good. And actually where you went for part two of that is kind of like where I was going to go for part two of it. So I'll expand on it a little bit. And this might be harder to answer, but I imagine that, as exactly what you're talking about as far as competition and where you can maybe channel dollars, right? If you're spending less on your healthcare plan as well, not only do you get the benefit as an employer of bringing top talent in because of a low cost plan, but if you're saving money, you can also use that to maybe pay more or do whatever it takes to get that top talent, in addition to just the health plan. Is that fair?
Yeah, exactly right. Yeah. And so a lot of our employers that we work with, a lot of times when they experience savings, one of the things we ask them is, okay, how are you going to reinvest this in your folks? Right. And so sometimes it's eliminating those employee contributions that have built up and up and up over time. In other cases, it's paying them a bonus. And, So they kind of have so there's some creative ways that you can apply that, whatever's going to work best, in your organization. But yeah, that's 100% spot on. Yeah.
Okay. Yeah, that's good. This is good stuff. So as we start to maybe wrap up, I do have a question, because I want to make sure, we have a lot of employees and employers that listen to this. So if we have somebody who doesn't have this type of plan available to them, I'm hoping maybe you can share any tips that they may be able to use if their employer doesn't have this available, that they can still maybe minimize their costs, or, find ways to use some of these strategies, I guess. Does that make sense?
Yeah, it does. Absolutely. So outside of the obvious of, I'll give myself a little plug here. Certainly make sure to introduce me to your CFO, your HR director, or the owner of your company. But outside of that, yes, and this is something I get a lot, particularly this time of year. There's a lot of people, friends and family and acquaintances and everybody else, that come to me with questions about health insurance, open enrollment, this and that. And we at our firm just strictly work with companies that want to eliminate their employees out of pocket while guiding them the highest quality healthcare. But one of the things that I've found, and we've implemented with every one of our groups now at this point, and continue as we bring on more to implement this strategy, is it's kind of like GoodRx. Most people are familiar with that tool as a way to save money on their prescriptions. I'll pick on them for a minute, but one of the things that they're doing is a couple things they're doing. One is they've kind of, in my estimation, have bait and switch pricing, in that when you look up on that app, they'll give you a range of prices of, your Humira might be this amount, but it might be this amount. And you can get that smaller amount if you subscribe, or if you participate in their subscription service, kind of their premium membership, as it were. So to me, that's just kind of problematic on its face. And then the other thing that they do is they actually are selling their users' data. So again, just in this day and age, with how sensitive all that type of information can be, you've got to do what you can to protect yourself. And a lot of people just simply don't read the fine print, and that's okay. But so what we've found is there is an alternative to that, which basically does the same function, in that it's an app you download. You can look up information about prescriptions. It's got a geofencing feature, so you can see pharmacies that are in your area, and specifically the price that you're going to end up paying for that drug when you go into that pharmacy. There's none of this kind of range. There's also no cost to use this particular service, and they're not selling your information. And so the name of that app is called CleverRx. We'll put a link, I'm sure, in the show notes, and there's a couple helpful little videos that we always text out to employees so that they understand what this service is, how they can use it, and then they can share it. They can share it with anybody else, anybody in their household, friends, family, whatever. There's an easy function for you once you get in there and get set up with it, to share CleverRx with anybody you want to, really. And so that's typically what I find, is that there's quite a bit of savings. I've compared it to GoodRx. I've compared it to a few other services that are like that, as well as what a cash price would be if you were to just go in as a non-insurance customer. And it is something that operates independently of insurance too. And so when you think about, if you're have an employer-sponsored plan or an individual plan or whatever the case is, this is something that operates independently. So you're not paying a copay, you're not paying co-insurance, whatever. You're basically just paying whatever this negotiated price is by CleverRx with that pharmacy. And it's, as you imagine, it's a lot of the big chain pharmacies. It's some of the local independent pharmacies as well. Kind of, just kind of spans the gamut there, but it really works just about anywhere. And I found there to be quite a bit of savings there. And it's really super simple and easy to use. And like I say, literally anybody can use it. So.
Awesome.
Yeah.
That's super helpful. And I think it's fair to say, if you can, maybe get them in touch with Chris, and maybe there's a better option. So with that, Chris, if somebody does have any questions for you, or does want to get their CFO, HR in touch with you, what's the best way to get in contact?
I'd say, visit our website, gbsbenefitsgroup.com. That's a good place to be. I'm on LinkedIn quite a bit. I spend quite a bit of, probably too much time on LinkedIn, frankly, but that's always a good way to connect with me. And as a company owner myself, and as somebody who's in sales, I don't hide myself at all. My cell phone 253-228-8336. And so, yeah, I'd say any of those ways would be probably the best ways to get in contact with me, reach out, and happy to help however I possibly can.
Awesome. Well, thanks a bunch for your time today, Chris. This is really good.
Yeah, absolutely. I appreciate you having me on. And as we said from the front, go Cougs.
That's right. And if you guys have any questions for us, of course, feel free to reach out. You can email us info@mainsailfg.com.